Myself Deepika, Assistant Professor from the Department of Cardiovascular Technology, Yenepoya School of Allied Health Sciences. Today we will be discussing about the topic cardiac malposition. So these are the specific learning objective for this particular topic. At the end of this class, students will be able to explain the definitions and different terminologies that is used in the segmental approach to congenital heart disease, as well as they can classify the normal and the abnormal cardiac and visceral positions. And also they will able to know the prevalence of various congenital heart disease associated with different cardiac malposition. So coming to the definitions and terminologies, what is cardiac position? It is nothing but the normal cardiac location, the location of the heart inside our intrathoracic cavity. It can be normal, which is also called as Levocardia, that is left-sided, which can be dominantly on the right-sided, it is called Dextrocardia, as well as if it is positioned in the midline, it's also called as mesocardia. So what is cardiac malposition? It is nothing but the abnormal intrathoracic location of the heart, or the location that is abnormal which is relative to the other thoracic organs. What is situs? Situs is nothing but site or position. What is solitus? We can also pronounce it solitus. It is nothing but usual or normal, which is usually we will see, that is solitus. Coming to inversus, is nothing but opposite or reverse of the normal. Ambiguous is nothing but that we cannot differentiate, it is undeterminate or uncertain. Combining of all these two, situs solitus is normal position, situs inversus is opposite or reverse of normal, situs ambiguous is uncertain, undeterminate or ambiguous in position. So going to the abnormal cardiac position, we should know what is normal. Situs solitus, we will see atrial situs and the abdominal situs. So coming to the visceral situs, we should know what is the normal location of the liver, stomach, spleen in our body. Coming to the thoraco-abdominal situs, we should able to differentiate the bronchopulmonary anatomy. Coming to the last part, it is atrial situs, identifying which is the morphological right atrium and which is the morphological left atrium. Coming to the visceral situs, what is solitus? That is what is normal. The largest lobe of the liver will be on the right sided, spleen and the stomach will be on the left sided, what you can see in this image. Thoraco-abdominal situs, we should differentiate which side is the normal right lung and which side is the left lung. So basically these are the differentiating criteria for right lung and left lung. So right lung will be trilobed, and because of the trilobe it consists of a minor fissure, and that is absent in the left lung, and the main bronchus is above and behind the pulmonary artery, where in left lung it is below the pulmonary artery, and the upper lobe will take a more proximal to originate, where in left lung it is more distal to take off. Atrial situs, we should able to differentiate which is the morphological RA and which is the morphological LA. So these are the differentiating criteria for RA and LA. RA will have a appendage which is broad, blunt and trapezoidal in shape, where LA appendage is smaller, thinner and finger-like. RA has a crista terminalis and it receives the blood from SVC, IVC and coronary sinus, where LA has a pectinic muscle that is not beyond the appendage, and also it receives the four pulmonary veins. So these are the abnormality. When come to the thoraco-abdominal situs, we can have a solitus, inversus and ambiguous conditions. cardiac position can be levoposition, dextroposition or mesoposition. It's nothing but levocardia, dextrocardia and mesocardia. So visceral situs, if it is solitus, the largest lobe of the liver will be on the right side, spleen and the stomach will be on the left side. If it is inversus, largest lobe of the liver will be on the left and the spleen and the stomach will be on the right side. Where ambiguous is nothing but we cannot differentiate. It will be duplication of the sideness. So these are the images for situs solitus, situs ambiguous and situs inversus. Coming to the thoraco-abdominal situs, if the morphological right lung is in the right side, it is solitus. If it is morphological bilobed right lung, it is inversus. When we cannot differentiate of this condition, that is called ambiguous. So these are the images. Situs ambiguous, it's also called as heterotaxy syndrome. It is defined as the abnormality where the internal thoraco-abdominal organs will demonstrate a abnormal arrangement across the left to right axis of the body. So we can classify this heterotaxy syndrome into two, left isomerism and right isomerism. So right isomerism is also called as asplenia or bilateral right sideness, where left isomerism is also called as polysplenia or bilateral left sideness. So left isomerism, it's also called polysplenia. Why it is called polysplenia is left-sided structures are stomach, spleen. So when it is called left isomerism, so the left-sided structures will be duplicated to the right side also, where right-sided structures will be absent. So spleen which is present in the left side will also duplicate it to right side. That's why it is called polysplenia. Where in right isomerism there will be absence of the spleen, because in the right side we don't have a spleen. That's why it is called asplenia. And these are the abnormal conditions which will be commonly associated with situs ambiguous. Left isomerism is also associated with interrupted IVC and PAPVC, that is partial anomalous pulmonary venous connection. And the right isomerism is also associated with a large symmetrical and centrally located liver with total anomalous pulmonary venous connection. Coming to the cardiac malposition, Levocardia is nothing but it is a normal condition where our heart will be located predominantly on the left hemithorax, where apex is pointing towards the left side. Where dextrocardia is referred as heart is prominently on the right hemithorax, where apex pointing on the right side. Mesocardia, where the heart is located in the midline, apex usually points towards anteriorly and inferiorly. So these are the diagrams for Levocardia, Dextrocardia and Mesocardia. There is a terminology also called dextroposition and dextroversion. So what is dextroposition? It is nothing but the displacement of the heart on the right side, which is secondary to the other extracardiac causes such as right lung hypoplasia, diaphragmatic hernia. And dextroversion, it is defined as failure to pivot the cardiac apex during the embryology to left. So the cardiac apex will not be pivoting into the left, is usually associated with AV discordance. So these are the diagrams for dextroposition and dextroversion. So this is a rare condition which is called ectopia cordis, where the heart will be lying outside the thoracic cavity because of the deficiency of the anterior diaphragm. It is a very rare condition. Prevalence of congenital heart disease in cardiac position. Situs solitus levocardia, it's usually not associated with much congenital heart disease, where situs inversus with dextrocardia is associated with around 3 to 5% of congenital heart disease. And situs inversus with levocardia, they are extremely very rare variant where 100% we can suspect a congenital heart disease. Situs ambiguous or heterotaxy syndrome, it also have a high incidence of congenital heart disease. So this is a summary. So these are my references. Thank you.